And now I will just before introduce the chair of our next panel, Grace McGill, who gets the MPS Trustee Gold Star today for helping out in chairing. Grace is an immigration lawyer of many years standing, who's now head of immigration at Fernández-Reino. And I will leave it to her to introduce both the panel and the speakers.
Thanks very much, Sarah. Well, welcome to the second panel this morning. My thanks to Rebecca for setting a high bar in discipline in respect of time manager, and just to ensure the succession. She's sitting here beside me to make sure that I process the same way. So our panel, our second panel will be exploring further overviews of lives and experiences during COVID, and what indeed we have learned as we move forward and navigate this post-COVID world of ours. So we have an experienced panel to aid that discussion this morning, and I'd like to just move straight into the discussion by introducing our first panel member, who is Mariña Fernández-Reino, who is a PhD senior researcher at the Migration Observatory from the University of Oxford. I think Mariña is actually online. And we're there. Excellent.
Yeah. Hi. Yes. Thank you for inviting me to this event. I couldn't go at the end. It was initially canceled, my trip, due to the strike, even though at the end, because of the Queen's passing away at the end. Yeah, I could have gone, but it was just the trip was already canceled, so it was quite difficult to make it again. But yeah, it's a pity that I'm here. But yeah, I found this event very interesting today. Sarah invited me to talk a bit about the public attitudes during the pandemic of UK citizens towards different types of migrants, labour migrants in this case, including EU citizens. So I'm gonna explain briefly the project and some of the findings. Let me share the screen. Let's see if it works. Okay. Are you able to see it, right?
Yes.
Yeah. Okay. Okay, so this, just briefly, this is a project that we started last year. So we published some briefings in this about this topic, and we basically focus on the attitudes towards migration in different UK regions. In general, towards migrants being accepted to the UK as labour migrants, and also the perceived contribution to their economy. And we particularly pay attention to the issue of occupation essentialness. So whether these migrants were in essential or non-essential occupations. So go to the context and the motivation was the COVID pandemic, and as you are already familiar, the concept of the salience of key or essential workers was quite prominent. It still is, but obviously much less than during the period of the pandemic, particularly in some sectors, especially the health sector, social care, education, and other sectors. The share of essential, so-called essential workers was particularly high. So that is, most workers in those sectors were considered essential by the UK government. And we know that in some of these sectors, like, for example, health or education, but also IT, manufacturing, the share of migrants is particularly high. So particularly in the UK, some occupations or essential occupations were identified with migrants. And here I just copied some of the news and works that have been published last year on this topic, and the contributions that migrant essential workers made during the pandemic. The main research question that we have in this project was whether attitudes towards migrants in essential occupations were more favorable towards migrants in non-essential occupations. This is related to a whole debate that is in the literature about like which migrants to prioritize in labor migration policies. And you know that this has been a huge debate here in the UK. With the last government, the decision was to prioritize migrants in high skill or high skill occupations. And this we have this full focus of the discourse like admitting only high skill migrants and those in some shortage occupations, which very much overlap. Not always, but very much overlap with high skill jobs in the health sector, also education sector, etc. This is the title of our study. If you want to have a look in our website at the Migration Observatory, we publish some briefings about it. So we ran this survey during 2021. Most of it was during lockdown. So we started running the first wave in January 2021. So that was like the third national lockdown. And then we ran with the same people additional surveys in April and July 2021. And the sample was quite large. So we interviewed around 5,000 people. That means that then we can make comparisons across regions. So we have enough people living, in this case, in Scotland to make meaningful comparisons about our attitudes. What we were looking at, so in addition to other questions that we asked respondents about their background, the impact of the pandemic, etc., and whether they were migrants themselves or not, we also did like a small experiment, and we show people two different profiles of migrant workers that would like to come to the UK. So in this case, this is exactly what people will see. We varied the nationality and occupation, and they had to choose either person 1 or person 2, and then also rate each of the migrants in terms of which they prefer to admit to the UK as a labor migrant, and what do they think which migrant profile they think will be more beneficial for the UK's economy. This is the key of our, let's say, experiment. We vary the occupations of these potential migrants that were shown to respondents, and they could have all these different 12 occupations that vary in terms of let's say, skills. So some of these occupations have been typically by the government considered as low skill or medium low skill, and others have been considered high skill. And then, and this is the most important, some of these occupations have a high share of essential workers and others they didn't. And you know, like just to mention an example, for example, hospital doctors, they have been considered as essential occupations, care workers, the same, but other jobs like, for example, waiter or waitress in a restaurant was not considered essential. And actually, we know that the hospitality sector was mostly shut down during this whole lockdown. And also other high skill occupations, like, for example, IT specialist in an insurance company was also not considered an essential occupation. So here, these are the findings. I'm just going to explain what we found. When we compare the essential, like the preferences of respondents with respect to essential occupations, we see that people or respondents were more likely to choose migrants that were in their profile coming to the UK to be in an essential job. And this is 22% more likely to support these migrants for coming to the UK. And in terms of benefits for the economy, they were still more supported than migrants in non-essential workers, but the premium, let's say, the preference was smaller, was only 10% more likely to be chosen compared to migrants in non-essential jobs. And this is something that maybe we can discuss later if we have time. We also saw, and this wasn't a surprise, that people tend to prefer also migrants in high skill, coming to high or medium high skill jobs. And this is something that other researchers find in the past. An important thing that we wanted to highlight here is that a person can be an essential job, and this job, both essential jobs can be high skill or non-high skill. So it really varies in terms of the distribution of skills, the essential. So people, for example, working as a meat packer, even though they has been considered non-high skill, so low skill by the government, they were essential during the pandemic because they were producing like an important commodity, well, in this case, meat. And this is something that might be of interest to you. So here we're looking at the average rating given to essential and non-essential workers by regions. In this case, the scale is a 1.1 to 7 scale, and Scotland and together with London, they stand out because they are the regions and something that it's already well known with most positive attitudes towards migrants in general, regardless of whether they are essential or non-essential or high skill or non-high skill. And also the premium, so let's say this preference that people or respondents show with respect to migrants in essential occupation was smaller. This is only because their attitudes were overwhelmingly more positive in this region. So it means that they were less likely to discriminate people depending on their profile. They tend to be more positive in general. And this is, let's say, the big outliers here are Scotland and the London region. Just gonna go over this. So most of the main thing that we found is that the previous literature mostly only considered job skills as a relevant dimension to condition attitude. So basically, we knew that both governments and the average population were more favorable towards migrants coming to high-skilled jobs. But then during the pandemic, we realized that essentialness was also a relevant factor. So let's say people were also likely to or happy to admit people coming to so-called low-skilled jobs if they were considered essential. So for example, the most, let's say, famous case can be the care worker example, where people are really positive in terms of welcoming migrants coming to as care workers. There's also, and this is important, a substantial variation across UK regions in how people, not only in attitudes towards migrants in general, than we know that there is, with some regions like Scotland and the UK being particularly favorable towards migrants, and others being obviously particularly negative. But also in these places, people were less likely to discriminate migrants depending on whether they were coming to an essential or non-essential job, which makes sense because people are in general more positive towards migrants in these contexts, regardless of their occupational profile. And another thing that maybe, it's also relevant is the fact that some of these favorable attitudes might have already been present before the pandemic. Like we know, even this has not been very much discussed, that people were already aware that many of the health workforce, for example, were migrants, and were probably already aware that it was important to admit migrants for the UK economy in those positions where they didn't have enough people, local people, filling those jobs. So happy to discuss later some of the aspects.
That's super. Thank you very much, Marina, and thank you for keeping the time for us. I'd like to move on to Dr. Rebecca Keenan, who you all know is a professor from the University of Glasgow and is also a senior researcher with Migration Policy Scotland.
I'm not feeling any pressure at all about timing. Just slides to come up. So this talk is based on a research project that I'm involved with at Glasgow University, which is led by Dr. Francesca Stella, not to be confused with Francesca Stella, who was speaking earlier. And we're exploring language learning and migrant integration in Scotland. And it's based on qualitative research that we carried out in 2019 to 2021 in Glasgow, Aberdeen and Aberdeenshire. So perhaps the first thing to remind ourselves of is that language learning is a crucial aspect of migrant experiences and one that's linked in important ways to prospects for successful settlement. This includes specific tangible and material aspects of settlement, such as employment, but also perhaps more particularly career progression, and I'll come back to that. Access to and successful navigation of services, and we heard this morning about some aspects around language and access to services. And knowledge of and ability to properly claim rights, including labour rights. And there's evidence that lower language skills mean higher vulnerability to exploitation, marginalisation and deprivation amongst migrant communities. Language learning also impacts on more tangible but equally important social and cultural aspects of settlement, providing opportunities to develop wider positive social ties to other language learners from different migrant backgrounds, as well as to host communities. in part simply as a result of improving English, but also sometimes as a deliberate aspect of community-based language learning initiatives. Language classes, language cafes, and conversation groups can be an important space for discussion of cultural differences and similarities, and a place for learning about how, where, and with whom to discuss problems, access support, or interact in particular situations. So Scotland has a vibrant and diverse ESOL landscape, and this has been supported by successive Scottish Government ESOL strategies between 2007 and 2021. The range and scope of provision has developed and grown substantially, in part thanks to the increased demand from and geographical spread of EU nationals in Scotland since 2004. There are now classes and groups available across virtually all of Scotland's larger towns and cities, and even in some quite small and relatively remote places like Turriff and Banff in North Aberdeenshire. EU nationals can learn English often but not always free of charge in a number of ways. They can join courses at local further education colleges, many of which offer both full-time and part-time programmes, often with very direct pathways into further vocational courses or higher education. Alternatively, they can join community-based classes provided by local authorities and/or third sector partners, and these normally provide 2 to 4 hours of learning a week in evening and daytime classes. Finally, there's a variety of language cafes, conversation groups, befriending schemes, community hubs, all provided by third sector organisations and initiatives. And these offer a whole range of learning opportunities, from quite formal classes to activities with much more focus on promoting social connections or focusing on the specific needs of certain groups of learners. However, for a group as widely dispersed and diverse as EU nationals, and given the limited resources of ESOL providers, recruitment and outreach can often seem a bit haphazard. Most of the people in our study said they had found classes by chance, by word of mouth, or by informal referrals. We did find some quite targeted initiatives involving employers in work-based learning, for example, or family learning linked to schools and nurseries where there were high numbers of EU national children, but also quite a few providers stated very clearly that they just didn't have the resource for more extensive and active outreach, and that they were more or less just there for those who came to them. For several providers, whilst EU nationals, especially Eastern Europeans, had been a key group of learners in the past, other groups, like Syrian New Scots in Aberdeenshire or asylum seekers and refugees in Glasgow, were now seen as a much bigger focus and were described as more easily identifiable as groups of learners, and learners, certainly in the case of New Scots Syrians, with more resource attached to teaching them. Looking from a learner's perspective then, it's important to think about what motivates EU nationals to improve their language skills and what kind of language learning is feasible for different groups of people given their circumstances. It's very clear from our research that people decide to prioritise learning English at different points in their migration journey and their move towards settlement. Particularly whilst free movement was still in place, this was often linked to a very gradual process by which migration choices evolved and short-term or temporary stays sometimes became much longer forms of settlement. For newer arrivals under the points-based system, this might change as migrant choices become more constrained, and a recent report by the Learning and Work Institute has pointed to a potential increase in demand for intermediate and advanced training and for language programmes that are more directly linked to professional development for an already skilled labour force. However, looking at Scotland, I think it's really important to point out that the majority of EU nationals currently living in Scotland are those approximately 300,000 who arrived during free movement and now have either settled status or pre-settled status here, suggesting that they have an intention to stay longer term. And recent migration patterns suggest that the numbers of new arrivals have fallen, and so this is likely to be the picture looking ahead. Many of these EU nationals have been here for a considerable amount of time, but managing on fairly limited English language skills. This hasn't stopped them working, coming back to my previous point about employability, but it has contributed to keeping them in low-paid jobs with associated losses for them, but also for Scotland in terms of human capital, productivity, and so on. It's hindered their effective use of and trust in services, including the health service and education, and it's left them less likely to have larger and more diverse social networks, contributing to isolation from and sometimes frustrations between colleagues, neighbours, different groups of parents at school, and so on. Improving employment prospects is a strong motivation for many learners, although not all, and more intensive and formalised learning at college might be the quickest way to substantially improve language skills. But given the age, family and working profile of most EU nationals, it's unlikely to be possible for everyone. Formal college courses are generally more likely to suit younger people, and amongst EU nationals, they seem to attract more women than men, especially men over the age of 30. And even part-time courses are often too intensive to combine with full-time employment. So this age and gender profile of college language learners is linked in complex ways to life stage, work patterns, and family roles. Learners in our study who had joined college courses were often attracted by the very structured approach to language learning, the institutional framing, and the pathways to career progression that it offered. And they were usually strongly motivated by wanting to improve their own job prospects and to move on to less manual and better paid employment. Many of them were, however, combining their courses with paid employment, working night shifts or back shifts around daytime classes, and some really struggled, sometimes dropping out as a result. The timing of classes, their frequency, and the ability to fit them around other aspects of life can be very challenging, and flexible provision or a mix and match approach can work for some learners. So several women in our study were coming back to language learning at community classes alongside work as their children got older, and they were often motivated by wanting to help their children with school, but also keeping up with their children's language learning as English became the dominant language at home. They talked about wanting to make better social connections and to increase their self-confidence and independence. For these learners, sociability and opportunities to learn about and discuss their experiences of life in Scotland were what mattered most, and they linked this more or less explicitly to feelings of empowerment, independence, and self-confidence. For them, combining community language classes with conversation sessions at language cafes often worked well. Very briefly, in terms of COVID impacts, then we found formal classes went online very quickly. More community-based initiatives sometimes took a bit longer, but also soon became Zoom cafes and WhatsApp chat groups. In Aberdeenshire, we found some provision was merged, combining smaller groups of learners across larger geographical areas, and this had a side effect of bringing together more diverse groups of learners, which EU nationals were very positive about. Inequalities around digital literacies and access to equipment seem to be less of a problem for EU nationals than some other groups of learners, but it was certainly a problem for rural areas around broadband and fast enough connections. Both learners and teachers thought formal language teaching got harder online, especially for beginners, but lots of learners talked about the social contact of their language classes as a lifeline during lockdown. And there were a lot of the same pros and cons as for home working around learning from home whilst juggling childcare and other work tasks. So in terms of lessons for the future, EU nationals, whether newer arrivals or here for several years, definitely still need support for language learning. There's no one-size-fits-all ideal in terms of provision, and the richness and diversity of Scotland's ESOL landscape is impressive and an asset. But there's some learning we could do around digital provision and its potential benefits in the longer term, and how to combine these with getting back to face-to-face learning. Thank you.
Thanks very much, Rebecca. Slightly over.
3 seconds. 3 seconds.
Thank you. Moving swiftly on, I'd like to introduce Jenni Keenan, who is an Empowering Communities Team Manager at PKAVS. PKAVS. Thank you.
Thank you. And I should have slides as well. Thank you so much. So yeah, I'm Jenni Keenan. I work at PKAVS in Fernández-Reino. So I wanted to give a snapshot this morning of some of the work that we were doing there during the pandemic and since. So for a little bit of background, Fernández-Reino is home to a wide range of minority ethnic communities, primarily, historically, that has been EU migrants to Perth and Kinross, primarily from Eastern Europe, largely motivated by the agriculture and hospitality industries in Perth and Kinross. In recent years, we've seen quite a quick change to the demographic in Perth and Kinross, which has really changed some of the work that we're doing. And I will touch on that at points, although obviously keeping to the discussion about EU nationals more broadly. We have seen the arrival of several groups of new Scots, including folks from Syria, Afghanistan, Ukraine, and most recently in contingency asylum accommodations with single males seeking asylum, which, as you can imagine, presents a whole host of new and different challenges compared to what we've been used to doing. In terms of what I'll talk about, it's useful to share that as well as managing the Minority Communities Hub at PKAVS, I have a leadership role in the third sector interface. So I will touch on some elements around third sector support and what that looks like. So just to start us off, coming out of the first lockdown, we did a piece of work speaking directly to communities, a big piece of engagement work using those roots and that trust and communication that we have with communities to try and understand what the pandemic and what that experience was for the folks that we were supporting and working with, and what some of the needs coming out of that work. Nothing that's on here is going to be surprising because I think you've heard a lot of it this morning already, and particularly Agnieszka touched on a lot of the things that I'll mention. We found that redundancies increased significantly, particularly during the first stages of the first lockdown before the furlough situation was clear, with folks whose accommodation was often attached to their employment, and that presented challenges. We also saw disproportionately low use of furlough for the communities that we were working with. On top of that, coming out of that period, there was a clear appetite for wider employability support and what that would look like, particularly support to navigate those systems around job seeking, around qualifications, and what that looks like for folks who are coming into a system and seeing it through fresh eyes. The issues around reduction in income and no recourse to public funds have been touched on. Marley and Agnieszka both touched on destitution and what that means. And in Perth and Kinross, it's a new challenge and an interesting challenge in that we're an area that has traditionally been home to EU migrants. So no recourse to public funds is not an issue that our public sector or third sector are geared up to respond to in a quick way and have solutions to. And I would also add to that the demographic that are now finding themselves having no recourse to public funds are different from those who would be, for example, seeking asylum, and there is an end date and a way out of that. We're more and more now seeing people coming and seeking support where actually there is no route for them long term in terms of remaining in the country, accessing employment, accessing social security. And folks are still routinely being employed and brought over by agencies and by employers in Perth and Kinross who will not have leave to remain in the UK in the long term. And so those destitution cases are rising, and we do not have an adequate answer for how to support people who find themselves in that situation. And it is becoming increasingly challenging, dare I say, dire in terms of how we respond to that. On top of that, a lot of the feedback came back around access to housing, affordable and appropriate housing, because of those industries that people are coming to work in Perth and Kinross. And those are mostly in rural areas, so there is a lack of appropriate housing, and that leaves people vulnerable to different types of exploitation. And there are examples of cases we've seen where folks are provided with that accommodation by their employers, and either it's substandard or they then find themselves in quite a tricky situation. Access to healthcare, we came back with some really quite startling responses to. The vast majority of people we spoke to had significant issues accessing healthcare, particularly during the first lockdown. Appreciating that would be echoed in other areas of the community too. There were over half of the people that we spoke to said that they had an issue go unresolved, and over 75% were sharing that they had symptoms of poor mental well-being coming out of the pandemic. And for communities who traditionally, in our experience, are not particularly forward in discussing mental well-being, that was particularly startling for us to see that was so high up the agenda for people, how they were feeling mentally, that people were really seeking support. And again, Agnieszka touched on the issues there around appropriate mental health support and where that sits, particularly if there are language needs in and around that, and the comfort level people have with, for example, seeking talking therapy if that's not been available in their first language. Finally, one of the really interesting things that came back from people was an accident in the phrasing of one of our questions, where we had asked, do you feel closer to your neighbours and community during the first lockdown than you did previously? And in the answers, people separated those two terms. It was a complete accident on our part that's how that wasn't what we were looking for, that wasn't framing. But what came back was very clear, that people saw their geographical neighbours as their neighbours, and in a lot of cases saw the people that they shared a language and a culture and a background with as their community, and that's how they would separate those two things out. I'm obviously speaking of our specific context in Perth and Kinross. I can't speak to the migrant experience as a whole, but what seemed really clear to us there was how we look at responses locally when we focus so much on locality working. How do we frame communities of interest within that, and how do we meet people where they're at in terms of that community building and in terms of getting involved, getting stuck in and supporting people. I'll just flick on to a quick case study to illustrate the environment that we were working in. So there's a factory in Perth and Kinross with over 1,200 workers, 90% of whom are migrant workers, over 17 languages spoken within the factory. There was a COVID outbreak during the first lockdown. So these are essential workers who were then told overnight that themselves and their entire families had to remain in the house. They couldn't go out and do a quick shopping first. There was none of that. They just had to stay in. There was a significant partnership response to that, which we were pulled into. And I think one of the key things that we were able to bring to that was as well as actually getting involved in making calls to people and checking in on them, and that side of the response was in sharing information with public health and with the local authority about what that really meant for people. There was an assumption that everyone has someone that can go out and do a shopping for them. If you lock down an entire factory, that's actually people's support networks are within that factory, and what they see as their communities within that space. And so there was something really key for us in pushing for the support that was required to actually be a bit bigger than it necessarily would be in a different but similar circumstance. And that was a particularly tricky situation to navigate. And one of the things that became really clear as well was there has for a long time been a local resentment of that factory being within that community, and that has often come out as resentment against the people who work there. And there's nuances to that, and it's a complicated situation. But the local community were very, very quick, I would say, to jump on this situation. And there was a lot of tension within the community that was quite tricky to navigate, and that we've yet to find a kind of explanation and solution for, but is worth bearing in mind when we're thinking about who becomes the scapegoat in situations like this, and an assumption that people couldn't possibly have been following the rules if this had happened. I'm aware that I am running very short on time, so I'll try and make this very, very quick. In terms of looking forward, I touched on the huge gap in response around NRPF and leave to remain, so I'll just leave that sitting as something to think about. And I don't think I need to go into too much detail about ESOL, as Dr. Kay has gone over a lot of that, but the issues around access to your employability rights, knowing where you sit within the community are huge. And those demographic changes that I mentioned have such a key role in Perth and Kinross, because actually our ESOL at the college and across the third sector is completely oversubscribed, and we're all having to turn people away. And it is the communities who are more established and more settled who are actually paying the price of that. So that is the EU migrants who are paying the price for that, because there's a response to Ukrainians, there's a response to asylum seekers, that is slightly more geared up. Just finally, to make a very brief point in 3 seconds on the third sector. You've got an extra 20, I'll take them. To make a very, very brief point on the third sector response, particularly in panel 1, We've heard a lot about the key role of the third sector in responding to the needs linked to Brexit and to the pandemic. And in light of the cost of living crisis and the needs associated with that, and actually the running costs crisis that the third sector is up against, there's a real challenge presented around the structure of support and response and what that means when the reliance on the third sector is as strong as it currently is. I'll leave that sitting there. It might be something people want to discuss, but I personally think it's something worth considering if we're talking about sustainable support for the communities who need it.
Thanks so much, Jenny. I'd like to move on now to introduce Sharon Wright, who is a Professor of Social Policy at the University of Glasgow, and also Dr. Anna Gawlewicz, apologies, okay, also a lecturer in Public Policy and Research Methods at Glasgow University.
Thank you. I'm so absorbed there, especially what you were saying, Jenny. I was like, oh, I wonder if this quotes me. Yes, I knew that. So we've been doing some research during the pandemic with the Polish community in Scotland. And our research is funded by the Economic and Social Research Council and conducted with a range of other universities, Sheffield, Middlesex, as well as Glasgow. And we've been working with organisations, including Jenni at PKAVS and also Agnieszka's organisation, Phoenix. So you can follow us on Twitter. We've also got a lovely web page. So it's Migrant Essential Workers is the web page, and you can follow us on Twitter at Migrant Work. Hopefully that's understandable. Yeah, that changed. So we're also looking at essential work, and essential work is the type of work that's key for keeping British society and the economy running during the pandemic. We thought it was especially interesting to think of migrants in this context because by definition, their work is essential for the society, essential to keep us going. But migrants have been in this strange position where they're sort of seen in one sense as like heroes keeping the country going and they're about the clan, but also have this sort of long-standing difficult status, almost like villains who come to take advantage of stealing jobs or taking advantage of benefits. So we thought it was really interesting to look at the experiences of this particular group. So the study was funded as a rapid response piece of research, and we decided to focus on Polish people in Scotland because it's the largest group of EU migrants. And we conducted an online survey. We thought, until I heard about Marina's 5,000 person survey, we thought this survey of over 1,000 people was enormous. And 386 of those are in Scotland, so we can still say some quite meaningful things based on that about Scotland. We also did qualitative interviews with 40 migrants, 14 of them in Scotland, and expert interviews with 10 people, experts on migration and in organisations, 5 of which were in Scotland. So that's the research team there and our project partners that we are incredibly grateful to. So the context of migration and COVID builds also on what Marina was saying about migrant workers being both higher skilled and lower skilled, and how that's reflected in essential jobs. Our study managed to capture both of those. We've got a real range of experiences of migrants doing those high and low skilled jobs. So migrant workers are disproportionately in precarious employment, even though some of them do have settled jobs in high skilled areas like doctors, for example. And they also face multiple insecurities relating to employment, difficulty accessing social security, where they have pure entitlements, issues with legal status and health. Migrant workers are also particularly affected in terms of mental health, and we'll come on to this again in a second. So the pandemic highlighted how migrant workers contributed to society and the economy, and we wanted to understand what it was like to live through that situation. So I hand you over now to Anna.
Thank you, Sharon. So we've noted various health impacts on migrant essential workers, and those impacts span both physical and mental health, and this is powerfully reflected on the slide. So the first quote is a man who nearly died. He worked actually in a fish factory in Scotland, a man in his 60s. He contracted COVID at work. He was taken to hospital, as I said, nearly died. When we interviewed him several months after that, he was still recovering, and he probably won't be returning to work. So it really just shows how, how profound some of those impacts can be. But of course, we also noted, unsurprisingly, a lot of impacts specifically on mental health. And this is again powerfully reflected. So here, the second quote on the slide is a police officer in London, and she spoke of how difficult it was for her to survive basically through holidays, Christmas, Easter, and so on, because she couldn't visit her family. She couldn't visit anyone for that matter, even her friends. She does have extensive social networks, but she really felt she was stuck at home. Thank you. We also noted a range of economic impacts, and again, this probably is totally unsurprising to you, and many of those points have been made already. From redundancies, pay cuts, reduced hours, quitting, also due to childcare, the need to provide childcare, through unpaid sick leave or unpaid quarantine, to no furlough opportunities as well. We had cases of people being rejected, social security support being rejected, universal credit, sometimes unlawfully, and also some cases of no recourse to public funds as well. What we found is that those economic impacts were oftentimes closely linked to health impacts, but also to the legal status, also to gender as well. One thing would lead to the other, as in sort of chain reaction. We really like that analogy of chain reaction, where all those things are interconnected. I think many previous speakers made that point already. Speaking of cultural, social impacts, one thing that we noted, one thing that came out really strongly was that participants had significant difficulties combining work with childcare, with homeschooling in particular, and this affected mostly, or to a significant degree, women. And before what happened before the pandemic, these women mostly relied on support from family members coming from Poland, but that was no longer possible due to lockdown, due to travel restrictions. So actually some people in our sample had to give up jobs to provide childcare. Unsurprisingly, there were also a lot of fears about the family left in Poland, in particular about aging, disabled parents, ill family members, and there was really a very strong sense of powerlessness due to the inability to go to Poland to visit them. And some of those fears were also amplified by vaccine hesitancy. And on that point, we noted that vaccination attitudes traveled from Poland to Scotland. It was really interesting because people in Poland seem to influence their family members in Scotland, and this is probably because Poland has a very strong anti-vaccination movement. So around 35% of our participants in the Scottish sample were unsure or unwilling to take the vaccine, which is quite a lot. Okay, so I'm just wrapping it up. So what is coming quite strongly is that the pandemic has been affecting migrant essential workers in very different, in very uneven ways, and depending on their individual circumstances and those unique intersections of gender, age, class, sexual employment, type of job, as well as family circumstances, health circumstances. All these led to significantly different experiences of COVID impacts. And on a positive note, we have found some real ways to improve the situation. We have developed a set of policy recommendations. I have a few copies here with me. Happy to share, but you can download the electronic version by scanning the QR code on the slide, and we're happy to discuss those recommendations in the Q&A, because I believe we're running out of time at the moment. So I'll stop here. Thank you very much.
Thank you very much, Sharon and Anna. That is some super fascinating information coming out.